Dr. Sharfstein, I thought of you this weekend when I looked down upon Central Park and saw that, yeah, maybe sort of kind of like we were socially distanced, but the truth is there were a lot of people in Central Park. The whole operation here seems to wrap around masks, masks of different shades, masks that are bandanas, masks that are a scarf, masks that are just a hunk of cotton. Maybe there's some medical stuff, and a very few select people have the fancy N95 masks. Give us a clinic now. Are masks, are they going to be what gets this nation back to work?
I think masks will help a little bit, and I think it's a good idea for people to wear masks. They don't have to be the fancy medical masks. In order to protect other people, what the mask does is block the droplets coming out of somebody's mouth, and because people aren't sure, they may not be aware that they are infectious because the symptoms haven't started yet. It's a good thing to wear a mask to protect other people. But the real thing that protects people is the distance between them, the physical barriers, the 6 feet, the redoing the schedule so there are not as many people in the office. All of those things are important. The masks are kind of like the icing on the cake, so to speak.
Joshua, it's good to hear that the masks are an icing on the cake, but the idea here, and you see it in the Washington Post chart of a 7-day moving average, clearly the tone is we're moving to a better place. Where is the place we're moving to?
Well, I think it's good news, obviously, that there's been a little bit of a drift down, and I think a lot of people are taking a lot of precautions, which is good, and people have to maintain that. You know, the virus appears to be a little slower to transmit in the heat, so that's a good sign for the time being, but it also means that we could be getting a false sense of security that we're distancing enough, and when the fall hits, it could go right back up again. So I think it's still pretty uncertain right now.
Josh, give me a sense of what we know about immunity, right? Do we have a clearer sense now than we did even 10 days ago about how many people are immune?
So I think that there's a lot of positive signs and some more recent positive signs that there is evidence of immunity, but the case hasn't been proven. And so the positive signs include animal studies where the animals get re-challenged and don't seem to get sick again. The fact that there really aren't compelling stories of scientific investigations of people who have gotten very sick twice with different strains. I think more evidence will come out, but we're going in the direction that when people are sick with coronavirus, they may have less of a chance of getting sick for some period of time. And that's good for a lot of different reasons. Now, that's a little bit different from saying we know exactly how to measure that, and so the tests have to be really calibrated with that. So I think we're getting a little bit more optimistic that such immunity exists. We will be able to measure it, and that will be good not only for some people's knowledge about whether they're relatively protected, but it'll be good also as a sign for different kinds of therapies. It makes it hopeful that maybe the convalescent serum will provide some protection. And of course, with the fact that immunity does exist, once we know that for sure, that would be a good sign for a vaccine.
Josh, when do we find out whether contact tracing is really effective in protecting people?
Well, we know contact tracing is effective in general. The question that we need to know is whether the United States can launch programs that do it well. And that depends on training. And, the Johns Hopkins training course now has over 150,000 people enrolled, which is great. It's free online. But a lot more is needed because these programs have to be run very well. You have to be able to find contacts quickly. You have to be able to support people in quarantine, get them food if they need it, get them other supplies, move them to a different place if they can't safely quarantine at home. These are the requirements that have been successful when implemented in other places. If we can do that well, it'll really matter.
Joshua, it's unfair to ask this question, but it's so emergent right now, particularly for the Midwest. I thought I'd ask it. I don't want you to comment directly on the Panhandle, but in Texas, where they're really starting to open things up, there seems to be a focus on Amarillo, Texas. Are we going to see a lot more of these? Or, I don't like the phrase hot spots, but statistically, are we going to see these flare-ups around the country?
Unquestionably, we will. And I think particularly as we open up, there are just a lot of risks. And, we saw just one choir practice had like 60 people infected and 2 died. We're going to see situations where, people who may not realize that they're sick or feel mildly ill and don't think in a million years it could be coronavirus, go out, they're not wearing masks, they get too close to other people, and we're going to find out that it's still a virus that has tremendous capacity.